Dear colleagues, this is Laurenz speaking from Rostock, Germany. I would like to present to you a case of a 24-year-old professional male football player suffering from adductor-related groin pain. The player came to us complaining of groin pain that had been ongoing for about a year. Conservative treatments, including physiotherapy, rest from sport, extracorporeal shockwave therapy, and local injections at the adductor insertion sites were not successful. An ultrasound ruled out inguinal hernia and sportsman hernia. As the first imaging modality, we performed a flamingo view X-ray, which is an AP pelvic radiograph in alternating single-leg stance. This is a standard examination in our department for suspected Osteitis pubis, as it helps to functionally assess and classify vertical instability of the symphysis pubis. As a simple introductory question to mark the symphysis, this should be self-explanatory. The next question concerns the diagnostic value of the flamingo views. In this case, answer A is correct. In case of symphysial instability, we often observe a vertical shift of the swing leg side compared to the stance leg side. In our patient, the swing leg side drops by 3 mm compared to the stance leg side. According to Williams et al., this finding is consistent with vertical instability. Next, let's take a look at the MRI. In the T1 weighted sequence, we can see degenerative changes in the symphysis pubis that are quite advanced for a 24-year-old. Both facies symphysiales of the pubic bones show irregular margins and beginning osteophyte formation. When osteophytes are clearly visible, this is also called pubic beaking. In fat-saturated, fluid-sensitive sequences, we can see a cranial disc extrusion towards the bladder. Such advanced degeneration of the pubic joint is commonly seen in young professional footballers. This degeneration is called by the specific kicking mechanisms in football. A combination of spinal extension, single leg stance, and a powerful swinging motion of the kicking legs are leading to functional opposition between the adductors and the abdominal muscles, creating high mechanical stress on the pubic joint. This stress also leads to aseptic inflammation, which characterizes osteitis pubis. This aseptic inflammation can be detected as a juxta-articular bone marrow edema of the pubic bone in fluid-sensitive fat-saturated sequences like the steer sequence, as we can clearly see here. In addition, our patient also shows so-called cleft signs. Cleft signs are microtears at the adductor insertions of traumatic origin, which are connected to the physiological symphysial cleft, also called primary cleft. Depending on the location of these tears within the different tendon insertions, we distinguish secondary, superior, and when both are present, so-called complex cleft signs. In our patient, a linear high signal is visible on the inferior margin of the left superior pubic ramus in the coronal steer sequence. This presents a microtear at the conjoint tendon of the adductor longus and rectus abdominis muscles. So we can say a tear within the prepubic eponeurotic complex. This is referred as a superior cleft sign on the left side. Additionally, we see another linear high signal at the inferior pubic margin at the insertion of the adductor brevis muscle and is known as a secondary cleft sign. Since both cleft types are present on the left side, superior and secondary, the patient has a combined cleft sign on the left side. According to Kahn et al., the site of the cleft signs corresponds with the site of clinical symptoms, which matches our patient's left-sided leading groin pain. Furthermore, our patient shows vertical instability of the symphysis, A colleague from our institute, Dr. Holl, demonstrated in 2023 that patients with cleft signs almost always have anterior pelvic ring instability in the flamingo X-rays. For therapy, we performed a fluoroscopy-guided injection into the disc cavity of the symphysis. The injection of a steroid and a local anesthetic, we used triamcinolone and carbostazine, led to a complete resolution of symptoms, and the footballer returned to full performance. A surgical arthrodesis of the symphysis could be avoided. Thank you very much for your attention.